Hi, everyone. Thank you for joining us today. My name is Lisa Honka, and I have a company called Your Key to Senior Living Options. I am a resource for people in the villages who want to know what resources are out there for assisted living, independent living, home health, private duty home care, hospice information, long-term care information. And today we are joined by Dr. Yvette Flores from Cora Therapy to talk to us about balance and about what Cora Therapy can do to keep us strong and healthy and live active and productive lives here in the villages. So again, thanks for joining us today, Dr. Flores, and we look forward to hearing your third part of your series that you've been doing for us. Thanks again for joining us.
Thank you for having me, Lisa. I'm so excited to be here once again in this three-part series. As you can see here, the title is Top 3 Age-Related Changes That Make It Harder to Remain Active. I feel like we've covered a lot of great things in this three-part series, and today's the third of the three. And just to introduce myself, again, my name is Dr. Yvette Flores. I am a physical therapy doctor. I manage the Cora Physical Therapy Clinic here at Spanish Springs, and we have multiple clinics, Cora clinics, throughout the villages. And I'm just excited to be imparting some really important information as I understand that the villages is an extremely active retirement community, and we certainly want to hold on to some of our functionalities and our strength and our abilities so that we can enjoy our time here at the villages and all the amenities that it has to offer. So I'm going to jump right in. Here is what we've been discussing over the last couple of months. The first one I did was on loss of balance strategies. And if you've missed that, like Lisa said, it has been recorded and it's on her website. So I encourage you to go there and review this. There's a lot of really good golden nuggets for you to take notes on and start implementing to improve your balance and to prevent falls and to prevent further loss of balance. The second that I did a few weeks ago was on loss of posture. Posture is a big thing that we see that starts to significantly change as we get older. So there are things that I shared with you in that video on how to determine if you are losing good postural balance and what you can do to correct it, improve it, and maintain it, because there are things you can do to successfully hold on to really good posture. And if you haven't heard already, posture is key. Posture is everything. Posture is what allows you to be independently functional and living your day-to-day without feeling the need to rely on other people to help you. And today, which is equally important, equally exciting for me to share, is information on loss of core stability and flexibility. I realized just in treating patients all day long that a lot of them were never really properly educated on what is good flexibility and why is that important and what exactly is core stability and how does that matter to me. So we're going to dive deep into those two topics. So the first one I want to jump into is core stability. These are the questions that I'll be answering right off the bat. So the first is defining core stability. The second is what body parts and what muscles are responsible for good core stability. The third is when does that actually start to decline and why? The fourth is how do we impact the ability to continue to engage in recreational activities and hold on to and improve core stability. And that's the last question. How do we improve it? How do we maintain it? So let's jump right in and define exactly what is core stability. And then we'll go over flexibility next. These are the questions on flexibility that I'll be answering once we're done with the core stability. And a similar concept, we're going to define flexibility. We're going to talk about when it starts to decline and why. We're going to talk about how loss of flexibility impacts our ability to engage in recreational activities And then we're going to end with how we can improve it and maintain it. So let's start with good core stability. I found this diagram and I got really excited because it's such a great visual to understand where your core is. So if you look at that skeletal structure, there's a box in his torso, and it's located kind of where the lower ribs are, all the way down to the pelvis and the tops of the hips. Everyone, that's where your core is located. So if you were to put your hands there and visualize having a box there, that is the area that houses all the muscles from front to back and all the way around, that stabilizes your posture, stabilizes your spine, and allows you to properly move without risk of injury. So let's read what I wrote here. What is good core stability? Good core stability is the capacity of the muscles of the torso to assist in the maintenance of good posture, spinal support, and balance during movement. Such a great, simple way to just understand what good core stability is. In the front of the core are all the different abdominal muscles, and there's deep layers of them. It's not just the superficial one that everyone thinks is what good core stability is. You can have really bad core stability even though you have a six-pack, right? So that's not what we're talking about, but we're going to learn about that in just a second. The top of the box is the diaphragm, right? If no one's ever taught you how to properly breathe using your diaphragm, we can go through those today too. Well, I'll teach you a couple of ways that you can start improving that diaphragmatic breathing and that control. In the back of the box are your paraspinal and your gluteal muscles. These are the muscles attached to the back of the spine and around the back of your hips. And then the very bottom of the box is your pelvic floor and hip girdle musculature. And all of these different muscles play a key part in good core stability. So again, now that we're moving that box more into an anatomical sense, there's your anatomical box there, right? We highlighted all the muscles that are responsible for ensuring that you have a good core. What I want to do in the next slide is I'm going to dissect it even further so that we can see two different groups of core muscles. You got stabilizers and you got global movers. This right here, I feel, is such an important concept to just understand from the get-go, so that if and when you enroll in a physical therapy program to improve your core stability, you know, and you could be empowered to take ownership of ensuring that you have a really good physical therapy program set for you. You want to make sure that the therapy group is strengthening your core stabilizers equally more so than the global movers. The core stabilizers are the internal muscles that attach to the spine and the hips from the inside. The global movers are the muscles that are most superficial on the outside. And most people incorrectly think that if you strengthen your global movers, that you have great core stability, and that is not true at all. So what are the muscles that are internal, and what does that mean? Okay, so if we look at the left column there under stabilizers, there's 5 things that I wrote. There's the pelvic floor, there's your transverse abdominis, there's your internal obliques, there's your multifidus, and then there's your diaphragm. So stabilizers, when you think about stabilizers, think about the muscles that glue things together and keep things still. That is the big concept of this part of the core muscles. In the inside, when these muscles are strong, they keep things together, they keep things still. So when your arms are moving, when your legs are moving, when your torso is moving, like you're bending down to pick something up, or you're reaching high, or you're lifting a heavy box, you're getting in and out of the car, these stabilizers are going to tighten around your spine and your viscera, and they're going to hold everything in place from the center, even though other parts of your body is moving. And that is so profoundly important. And I feel like, actually, I wish, but then I get it, that when you walk into a generic gym, that some of the personal trainers would understand these concepts so that they could be more able to assist you in what you're looking for when you go to a gym for strengthening. But the reality is they're not medical professionals. I get it. So that's why you would then tell your doctor, you know what, can I do a few sessions of physical therapy because I want to learn about how I can properly strengthen my core. And it's through coming to licensed physical therapists like myself that you would then be able to sit down and be educated on the different muscles and their role in core stability and how to identify them, how to assess which ones are weak and which ones are strong in your body, and then learn all the different exercises and progressions to make improvements, and then be empowered with a home program that you can then take to your gym, and then you can do them on your own. At least in an ideal situation, that's what it would look like, right? So we just talked about the core stabilizers. Now, in terms of the global movers, more people are aware of these types of muscles. The first that's listed there is your rectus abdominis, and that is the muscle that gives you that six pack. So if you were looking at that diaphragm, the diagram on the right side, you can see the six pack delineated nice and neat there. And that whole muscle that goes up and down is your rectus abdominis. The second global mover is your external obliques. And those are the long muscles on each side of the torso, right? You could see them delineated there as well. The third one are your erector spinae. Those are the muscles of your back. And they're responsible for pulling you upright, right? So when you have really weak back muscles, you start to slouch forward. When you have really strong back muscles, you're able to stand up taller, you're able to sit up taller. It doesn't feel like it's a big deal. Those are your erectus muscles. And then if you look, there's a deeper muscle, and you cannot see this in the diagram, your quadratus lumborum. It stabilizes in the back for sideways movements, right? So when they're strong, you're not necessarily quick to fall down sideways because that quadratus lumborum can pull you right back up and prevent you from falling sideways. And then lastly are all the hip muscle groups around your bum, right? So your gluteus muscles, you got 3 layers of those. You also got lateral muscles on the outside of your hips. All of those things play a key role in stabilizing you and being a part of that external core muscle group. Okay, so like I mentioned earlier, I kind of want to show you a diagram that kind of dissects so you understand the different layers. And I know this one is a little hard to appreciate if you're not used to looking at anatomical diagrams, but the first one is the most superficial, the one in the middle, that's your rectus abdominis. And then the one on the outside left is your external oblique. These are the outside muscles that you could touch with your fingers, through your skin. Those are the first groups of muscles you can feel and you can palpate. Now, if you look on the right side of this diagram, the next layer would be called your internal oblique layer, and it's underneath the external. You can't really feel it just superficially. You need to know where to put your fingers and how to engage, and then you can feel it. And then the deepest layer, which is the layer we focus on the most because it's the layer that tends to weaken the quickest and the soonest, especially as we get older, is your transverse abdominis. And you can see they cut out a square of muscle into the external oblique so that you can look deeper into the torso to the transverse abdominis. And that is the one that we spend the most time identifying, strengthening, and empowering patients to learn how to find and strengthen when patients are sent to us for physical therapy because they have weak core muscles or chronic back pain or difficulty with their posture or they're falling over easily. These are the muscles that we start strengthening right away. Okay, so big question. How does core stability start to decline? And what can we do to prevent this? Whew, that is pretty loaded. Where do I start? Core stability starts to decline the minute we stop being physically active. Um, when we're younger, we have less aches, pains, we have less stiffness. We're more inclined and we're more motivated to move our bodies because it feels good to move and there's nothing hindering movement. As we get older, a couple of things can start to change. The motivation to move the body starts to change. We tend to get tired sooner. Maybe we are motivated to move the body, but we're feeling discomfort and pain and stiffness and achiness. And those types of feelings then start to reduce the motivation to move the body. Other things, age-related changes, doctors tell you you're now developing arthritis or stiffness, or you're prone to swelling. I mean, there's so many different things that could then change someone's lifestyle from being active to more sedentary. A sedentary lifestyle is the biggest reason for loss of core stability. Another thing that can lose core stability is back pain and hip pain. So if ever you've developed back conditions, back pain, have had back surgeries, and same with your hip pain, hip surgeries, we start to lose core stability because we're no longer able to move the body in a manner that continues to strengthen those muscles. I love this picture because it kind of shows very clearly examples of what your posture could look like if you're lacking strength in specific parts of your core. So if we were to look at the picture on the left of the lady walking and she's leaned way back, if I were to ask you, what muscles do you feel are really weak on her? Would it be the front muscles? Would it be the back muscles? The muscles that I see that could be weak on her are the front muscles. It's her abdominal muscles. It could be the superficial global movers like the rectus abdominis. It could be the transverse abdominis, which is really deep. If those muscles aren't strong enough that when contracted, they're not strong enough to pull your body more upright, then you could eventually start walking like that, or standing like that, or feeling like you need to sit down like that, or you're tipped back. And that's not good. That's not good posture. And that could lead to other issues and challenges that are easily preventable. The second middle posture is the exact opposite. Now, this particular one could possibly have a lot of weakness in her back muscles. Again, you have your transverse abdominis, which is the innermost layer, and it does wrap around from the front to the back. And then your most superficial layer are your erector spinae muscles, which are the superficial muscles that help you move your back to an upright position. When you strike a really good balance in your core, that's when you're able to walk more upright, like the very last picture, and you have less difficulty, less challenges, and more ability to be upright for longer periods of time. All right, so to answer the second part of this question, how could we prevent loss of core stability? I found this great simple diagram that I'd like to share with you. But here's my caveat. If you cannot get yourself in these positions because you have other medical issues, such as total knee replacements, things of that sort, then don't even try this. I'd rather you come in to physical therapy and allow us to properly assess you and tell you what exercises are appropriate specifically for you and your body. But just to give you an idea of what core exercises could look like, these are some. I think everyone could probably do the one sitting in the chair, raising your hand over your head and reaching and coming back in, reaching, maybe holding for 5 seconds, coming back in. You always want to engage your core when you're doing these exercises. I think everyone could probably do the ones laying down on your back. The bracing is the one that I give to everyone right off the bat. And I'll tell you this, the majority of people have a hard time doing the bracing. Whether it's because they can't tighten the muscle I'm asking them to tighten, or if they finally find it with my help and then they tighten it, they can't breathe through the exercise, they're holding their breath. We can't progress anyone past the bracing if they're not even getting the bracing. So right there gives you an idea, okay, if I can't do that exercise, I might need to go into physical therapy to learn how to strengthen from there and then progress from there. And then, the pictures that go down from there are a lot more advanced. I'll be honest, maybe 10% of our senior clientele are able to do the bird dog or the Superman. Those ones are super hard. But if you are able to do them, they provide a lot of excellent strengthening. But then again, that could be determined when you come in to be assessed to see if that's an appropriate goal for you or not. All right, so that was a lot of information on the core. I am eager to answer questions at the end of all this, and I kind of want to let you guys just kind of think about those points, and I'm glad they're recording this so you can go back and review everything that I shared there. But we're gonna switch gears now, and we're gonna talk about loss of flexibility. I feel like core stability, flexibility, postural stability, and balance, everything that we've been discussing through this series, they all are interwoven and they play a role to create a more balanced body. So this is the final system, I guess, that we're going to be discussing of all the systems, and that's flexibility. So again, these are the questions that we're going to answer. What is flexibility? When does it start to decline and why? How does loss of flexibility impact your ability to engage in recreational activities? And if you've started to lose flexibility, how can you improve it and how can you maintain it? So that's a great way to define what flexibility is. It's the quality of bending and moving body parts without breaking. Simple. And I know it gets harder as we get older. You want to bend down to pick something up off the floor and it's not that easy. Or you want to put on your socks and shoes and it's not that easy. So here in physical therapy, we know how to assess your flexibility thoroughly, and we know where your flexibility should be relative to your age. And we know how to educate you on safe, effective exercises to start gaining back your flexibility. And then before you're done with therapy, we know how to set you up with a home routine so that you can maintain your flexibility. But this is the next question we're going to be answering. How does poor flexibility limit participation in recreational activities? On the left there, that's such a great visual in terms of how you can quickly assess if you got good flexibility or not. We do that with the patients. That's not something we would want you to try to do by yourself, because someone needs to be assisting, holding your legs up so you don't hurt your back. And we also measure flexibility in standing as well, like the picture on the right. And we do, like I said, have the numbers to strive for based on your age. So let's talk deeper about, flexibility. How do we start losing it and why? Muscles are made up of fibers that slide in and out. When a muscle is stretched or lengthened, these long fibers slide away from each other. When we contract a muscle, they slide together. That contractility and mobility starts to stiffen as we get older. And there's a point where sometimes when the muscles are relaxed, they're still kind of stuck together. They're not fully relaxed and out away from each other. They're still stuck together. If we're not doing a daily routine of stretching to maintain that elasticity and that flexibility of the muscle fibers, that stiffness that you feel could become permanent. And then it makes it even harder to try to gain back. And in really, really bad cases, we've seen that stiffness calcify and then become fibrotic and develop adhesions. And then now, even with the efforts of physical therapy, we're having a hard time teasing out the fibers, lengthening them, and regaining that elasticity. The good news is, though, there is hope. It is possible to improve flexibility on all accounts. It doesn't matter how bad it's gotten. We know how to approach it and safely start to lengthen muscles that have gotten too stiff. These 4 pictures are from physical therapy. They are examples of some very common and safe ways to start lengthening and maintaining flexibility loss in the low back and in the upper back. I love these ones. We do these ones all day long with our patients as well, so long as they don't have other issues with their body. So I wanted to share that. All right, well, what else can we do aside from learning some general stretches or general core stabilizing exercises? If we've lost a lot, we're not sure if we're doing things right, what else can we do? My biggest thing would be to schedule a comprehensive posture, stability, core stability, flexibility evaluation with us. Let's allow us to take a look at you from top to bottom and determine what's gotten tight and stiff, what's gotten weak, what's gotten unstable. We're really good at what we do and we're passionate about it. And you know, our reward at the end of the day is seeing patients that have completed their programs with us, and we're giving them high fives, we're giving them hugs, they're giving us cookies. And it's just always such a rewarding win-win at the end of the program to see patients walk out of here feeling empowered and thankful for everything that we've helped them accomplish. So yeah, get that exam done, and then complete a physical therapy program, and then learn a home routine to maintain improved core stability and flexibility. And if there's more questions, or if you'd like to jot down the phone number that you can call or email me directly or check out our website, here's all the information so that you could start that process of feeling when it's a good time for you to reach out and allow us to help you.
So I have a question. When people are ready to start this, should they contact you first or their primary care physician? Who would they contact first? And what questions would they ask, or what information would they need to have on hand to get started?
I love that question, Lisa. I say that they can contact either or, because we work directly with physicians if the insurance requires a prescription to start physical therapy. But because Florida is a direct access state, if you are not looking to use any form of insurance and you just want to come directly to us, we can get that established as well without needing a signature from a doctor.
Okay, and so if they do need the doctor's referral, they would just call up, talk to the business office manager or front desk, let them know that they're interested, and then put in the request to you, and then you would contact the family and say, come on in for an evaluation, we've got a referral. Which office would you like to come to?
Yes, pretty much. In some cases, however, some physicians would, if they have a great relationship, active relationship with the patient, they would probably be okay with saying, sure, I'll write the script and I'll fax it over to Cora Physical Therapy right away. And it would be that easy. We would get the referral, then we'd call the patient to schedule. In other cases, however, some doctors want to sit down with the patient first and try to understand, well, what are we looking to accomplish with PT? What are your concerns? What's going on? And once they agree that, you know, physical therapy could be a helpful, supportive thing, then they would write that referral and then go through that process.
And it's really important to really talk to the doctor about how much ability you do have at home, right? Standing is painful, or you're feeling unsafe getting into a shower, or in the morning you feel it's hard to get going, right? So some of those full disclosures, I'm having trouble with, again, my balance, I've fallen, right? Or I feel like I'm going to fall, or I don't have as much stamina to go to the store. So really full disclosure and really explaining the situation, even over the phone with, again, the front desk person, to realize that this is really urgent to get going on things and that you do have a need, right? So
Yeah,
again, that's really important.
I love that you said that, because if they don't convey the physical, I guess, inabilities or impairments that they're experiencing right off the bat with whoever answers the phone, it might be easy for whoever gets the call to dismiss it and say, oh, we could fit you in 4 weeks or 6 weeks, or, just not feel like it's a big deal because it's not a life-threatening situation. But however, you could really hurt yourself if you are high risk for falls. And just by being proactive and saying those specific words that Lisa just mentioned when you're on the phone, you could get into physical therapy sooner rather than later, prevent further falls, and prevent like serious injuries like a fractured hip or anything like that.
Right, right. And again, if you know that you're going to be having some sort of surgery, it's also important to perhaps request upfront which therapy company you might want to use, right? As opposed to just, because I know you have preferred relationships with some of the doctors, but again, some physicians may not know about your excellent care that you provide in therapy. So it's important for the patient to be proactive. And in the other sense too, someone who has a loved one who has Parkinson's, or again, a neighbor who's you're watching and you're saying, gee, you have Parkinson's, or you have some balance issues, you've had a stroke. You can also say to them, I saw this Zoom call. It might be something you might want to do, is just reach out to your physician. Because again, sometimes we as neighbors might see someone limping, or someone, you hear about someone falling, you see the 911 visit from the lift company, right? So the non-emergency lifters coming to lift someone up. Maybe that's a person that could certainly benefit from, again, therapy too, before there's a catastrophic break, right, of a hip or shoulder or something like that. So sometimes when you see something, it's important to maybe say something to your neighbor who doesn't even know that this is out there and possible.
Yeah, and I'm glad that you said that, it's important for patients to request who they want to go to, or to just know that they're even allowed to request who they want to go to. Again, that is your legal right. You can go to any therapist, any provider that you want to go to. Even if your physician has their own physical therapy group, you are not required to go there. You can go wherever you want. So I just wanted to make sure you knew that.
Oh, that's good to know. Yeah, I know sometimes it's a direct order from the doctor, just because, again, they don't have time to go and learn about every therapy company. And so, again, who's been there in place for 10 years may not be the best ones today, right? And it's really hard for them to get out of the office. So again, with all your multiple locations, it's really good to know that there's one right around the corner from them. Also, I think we had a request to put up the slide again for your contact information. So I encourage anybody who is interested in a therapy, again, this could be years down the road, months down the road, weeks down the road, to take out your camera if you have it, your phone, and just take a picture of that slide so that you have it. I have it on my phone. I forward it to people. And I think it's an important contact information. So again, if your doctor has a request, your doctor has is saying, well, who is this again? You don't have to recall it. You just look on your phone. You could read off the information, right? So I think, again, take out your phone, take a picture of it and keep that in your contacts, because I think it is important to keep this. Again, you just never know when you're going to need it. You might end up having a medical event, by accident, or a friend does, and you say, oh, I saw this call and I learned so much. So why don't you reach out to them first? I do have a couple. I think we had a question. Let me go down here to the chat box. So on the chat box, let's see. And while we're doing this, so we put the contact slide up. We'll send the information. I know Maureen does a constant contact where she sends out upcoming events that we have. She sends out a newsletter, so that information will be on there. I think you mentioned there were 2 top muscle groups to strengthen for good upright posture. Oh, Nancy has a question. We'll get to Nancy's in 1 second. I think we have a bit of time. So what are the 2 top muscles to strengthen to maintain good posture?
So that's great. So going back to a few slides previously, muscles to strengthen for good posture would be your global movers and your internal core stabilizers, right? If I were to pick one muscle from each category, just to make it simple, the internal stabilizers, I would always pick the transverse abdominis, because it's the innermost abdominal muscle that directly attaches to the front of your lumbar spine. And it's the one that keeps the column in place, so that when you're moving and bending and twisting and reaching, if you were diagnosed with a herniated disc or arthritis or stenosis, when that muscle is so strong, it keeps everything together so you could move more freely without feeling so symptomatic. And then I guess a muscle, if I were to pick one from the global, external, more superficial stabilizers, I would probably pick the glute med. And the glute med is a muscle located on the back outside of your hips, and they are directly responsible for balance stability, so that when you're walking or you're transferring in and out of a chair or in and out of bed or in and out of a car and you're walking, should you lose your balance, those muscles, when they're strong, they will tighten around your hips, and you will not you'll have a higher chance of staying upright versus tipping over. Great
Oh, that's
question.
great information. Wow. So that's again, being proactive and preventing those falls is really important. So thanks for that, because I know a lot of people are diagnosed with spinal stenosis and you think, oh, is there nothing I can do? This is just progressive. But again, if you can really build up those muscles, it could change the possibility of a fall even. So that's great. Okay, let's get to Nancy's question. Nancy, does she have a question? Let's see if we can unmute her. Are you able to do that, Maureen?
Okay, I think I'm unmuted.
Yes, great, Nancy. Go ahead.
Okay. All right. Yes, this has been a wonderful presentation. I really enjoyed it. But my question would be, when you're speaking with your doctor and explaining, different problems you're noticing that you're having, and you ask for your physical therapy, does the script or the order that they write need to include everything for the physical therapist to be able to do? Or when you come in for your first meeting, as a physical therapist able to figure out more what you need so you get the right treatments for the different problems you may have? I was wondering.
Yep, that is a great question, Nancy. Thanks for asking that. I think it's, some physicians, when they write referrals to physical therapy, if they choose to be generic and general, they will literally write on the prescription PT, eval, and treat. That's all they write, right? So we receive those a lot. And then it's up to us to speak with the patient, like, okay, well, what exactly is a challenge for you? Do you have some physical limitations and difficulties doing things? And why? Is it because of pain? Is it because of instability? Are you falling a lot? And so we kind of do need to ask some questions to then understand exactly what is it that we're going to be evaluating and what is it that we're going to put together a plan of care for. Yeah.
So the doctor doesn't have to be very specific, because you will take that information and do a questionnaire, do a physical face-to-face evaluation, and then also look at balance and look at walking. And so you'll be able to put all the pieces together. Even if they write it generically, you are actually you're pulling in all the information far more than they could in a minute, right? You're really doing top to bottom, A to Z evaluations of the person to see what they feel their challenges are.
Yes, and I will jump in and say this. We've received patients that have shared multiple things like, oh, I have neck pain and shoulder pain and hip pain and ankle pain and knee pain. And we're thinking in our head, that's going to take all day to evaluate you. So what I ask them is, what is the most concerning, most debilitating part of everything you just shared? And then I ask them, is it okay if today's evaluation focuses on that, and that we put together a plan of care on that? And then all the other things we can address once we're done with that, the first particular plan of care.
Oh, that's good. So
Okay.
you sort of prioritize where you're going to go. And sometimes they're all related, right? So you have, you have a surgery, you think you're doing great. And then again, you kind of slide backwards a bit and you're thinking, maybe there's more going on. I had a fall, or I had a slight stroke, and now all of a sudden I need a whole bunch more, right? So again, everything's kind of related, but yet you prioritize where you're going to start. And that could involve more time with therapy, because you'll be evaluating benchmarks along the way. And then as you meet those benchmarks, there may be other issues that pop up in the meantime that you can get recertified for.
That's correct.
I don't know if that's the right word, certified or
So reevaluate it. And I love that
Reevaluate.
you're bringing that up, because especially in this, senior retirement community, it's unrealistic to think that you only have one problem or one physical limitation, right? So when you find a physical therapy that works well with you and you've established such a great relationship with, choose them to be your go-to for other things. I can't tell you how many of our current patients are repeat patients because they had such a positive experience the first time around with a specific diagnosis, that now they come back with a different diagnosis. And because if you live near our clinic or any of our clinics, if you have a positive experience, and you know the therapy group and you know how they work, and you know what the layout of their clinic is, and you feel comfortable, already start thinking ahead. Like when you start to feel better with one thing and then you wrap up that program, already start thinking about the next body impairment that you want to work on. But the cool thing about insurance companies, physicians, and physical therapists is we all agree that we want one main thing to happen for patients. We want them to be as healthy and physically able as possible, right? So because we agree on that one main thing, we will support another bout of physical therapy for something totally different if we need to. And it will be covered by insurance if we can show that it's a medical necessary thing. And we're really good at that. I mean, we tie everything we do to function. And if you are functionally impaired, we can write a program that shows that this is medically necessary.
And that's significantly important, because what you're preventing is a fall or a medical event that results in a hospitalization followed by a rehab, right? We're talking about maybe a $50,000 swing in what they're going to outlay versus some therapy, right? So the stronger, the more balance you can have, the stronger the strength you can have to prevent that fall, right? That medical event. Again, just even being aware of how you walk and how you go up steps and and the unstable sidewalks around the villages, even just simple things like that, getting in and out of bed, getting in and out of a shower, getting up out of a chair, getting in and out of a car, the simple things of just the physicality of day-to-day life. If you can prevent that fall, it changes not only, again, the expense of that insurance, but it changes the trajectory of your life expectancy, right? Life expectancy at 80 once you have a hospitalization followed by a fall or in a rehab stay, is 18 months.
Yep.
So if you can get some therapy and not have that hospitalization, your trajectory of your life expectancy significantly changes. And that's why the therapy is so important.
Now you know why I'm so passionate about this and why I'm so grateful that you had me come in to be able to share. So thank you, Lisa.
Yeah. Yeah, you're welcome. Again, I've been doing this a long time, 15 years. And so when I heard that almost 15 years ago in my career, I thought, you know, this is the most important thing, preventing falls, right? To be as strong as you possibly can, know how to fall, but prevent the fall, because life changes significantly after that fall, that hospitalization and then rehab stay.
Yeah.
So on that note, what are the top 2 muscles that we need to strengthen to get good upright posture? Because that's what we're going to leave with, and that's what we're going to work on ourselves. And if we think we need extra help, if we feel like we need a cheerleader, if we need, you know, our benchmarks kind of evaluate and see, are we as good as we possibly can? If we work on these things, but we don't feel we're doing that successfully or to our best of ability and need some guidance, we're going to be reaching out to you and your team.
Okay, so the first one is the transverse abdominis, and I'll walk you through this. I'm assuming everyone's sitting down. So you want to sit up nice and tall, and then you want to put your hands generally in the front of your belly, right? So you're not pressing on your belly, you're just resting your hands there. What I want you to do now is I want you to draw your belly button back toward your spine, away from your hands. Now, there's a lot here. If you can't do it, you automatically could pretty much tell yourself, wow, my core must be weak. If you can do it, but you're having a hard time breathing or talking, or you keep losing it and you have to keep pushing your tummy back again, and then it goes back into your hand, and then you got to suck it back, and then it goes back into your hand, that's a sign that your core is weak, right? So that could be a great exercise to do during quiet time, when you're watching TV, when you're sitting. Just put your hands there and then draw your belly button back towards your spine and hold it there for 5 seconds while breathing, and then start to improve the total repetitions that you're able to do. Maybe start with doing 5, then 10. But when you get up to 30 repetitions, breathing normal with really good contraction of those abdominal muscles towards your spine and away from your hand, you know that your core is already getting stronger with just that one activity. So the second one I'm going to leave for you when it comes to posture, upright, balance, I would say would be the muscles in between your shoulder blades. These are called your scapular stabilizers. Again, I'm going to teach this to you. So while you're sitting up nice and tall, you're going to squeeze your back together. Okay, you have these, your shoulder blades behind you. You want to pinch them together. There's muscles in between. When you do it right, your shoulders move backwards, your chest pops up and forward, and you feel a little pinch or muscle activity in between your mid back, in between your shoulder blades. Same concept. These are postural stabilizers. They get stronger when you hold that squeeze for long amounts of time and you do high reps. So you want to squeeze your scapula together for 5 seconds, and then you want to breathe and make sure everything else is good. You do 5 repetitions first, you do 10. When you get upwards of 30 repetitions of back squeezes with 5-second holds, and it doesn't feel like a big deal, you know that you're on your way toward improving your posture.
Holy cow, I worked out. I could feel it. It's the first one. I could feel it in my hips right away. So thank you. I mean, these are good things. We're on the computer. We're sitting there watching TV. We certainly can do these all day long in little chunks. So to see if we can gain some strength, it'll be interesting to see, in a month, if we continue this daily, how much progress we can make. But again, if we feel like we need more and it's just not coming together, we're certainly going to be reaching out to you. So thank you for this.
You're
Are there
welcome.
any more questions before we end? Does anybody have any questions they want to raise their hand? Or so I think we're probably coming to the end now. Again, thank you so much for all the information. We've learned so much. And again, I look forward to sending families to you to get stronger and stay safe. And again, thank you everyone for joining us. These will be archived, and Maureen will be sending out links to the 3 parts of this series. So again, thank you for your expertise, and I look forward to meeting you in person soon.
Thank you. You're welcome.
Okay.
Bye-bye.
All right. Have a
Take
great
care.
day. Have a great day, everybody.